introduction. Black fungus infection is a serious, life-threatening, angio-invasive but rare opportunistic fungal infection caused by a group of molds called Mucormycetes belonging to order Mucorales. The Mucorales is the largest and best studied order. Next, we'll see what is Mucormycosis and Zygomycosis. The infection caused by Mucormycetes belonging to the order Mucorales are known as Mucormycosis. Mucormycosis were once called Zygomycosis. Mucormycosis is also known as Black Fungus Infection. Next, we are going to see why we are calling Black Fungus Infection or Mucormycosis a rare opportunistic fungal infection. Before seeing answer to this question, I want to give you some important points about Mucormycetes. Mucormycetes are ubiquitous in nature and can be found on decaying vegetation and in the soil. These fungi grow rapidly and release large number of spores. The spores can be found in large number in damp interiors and around composing vegetation and even present as bread molds. Thus, Mucormycetes are common in the environment and also frequent contaminants in the clinical microbiology laboratory. Not alone this, all humans have ample exposure to these fungi during day-to-day activities. Most fungi produce thousands of spores. People get mucormycosis or black fungus infection by coming in contact with these fungal spores in the environment. If the infection occurred after inhaling fungal spores, it most commonly affects the sinuses or the lungs. If the infection occurred after a cut, burn or other type of skin injury, the area can look blistered, red or swollen. It might turn black or feel warm or painful. We must note one important point here, that is, the agents of mucormycosis are typically incapable of penetrating intact skin, but any skin damage enables the organism to penetrate into deeper tissues. Black fungus infection can spread in a body through bloodstream, infect other body parts and organs. Generally, these fungi are not harmful to most of the people. However, for people who have weakened immune systems, breathing in Mucormycetes fungi spores can cause an infection which can spread to other parts of the body and organs. Or we can say that fungi that are otherwise harmless but can take advantage of people with weakened immune system and invade tissues. This is why black fungus infections are also called as opportunistic infections. The major risk factors for mucormycosis include diabetes mellitus, metabolic acidosis, treatment with corticosteroids, organ or bone marrow transplantation, neutropenia, trauma and burns, malignant hematologic disorders, etc. Rhizopus oryzae is the most common organism isolated from patients with mucormycosis, followed by Mucor species. Thus we learned why we are calling black fungus infection as an opportunistic fungal infection. Next, we are going to see why we are calling black fungus infection is a serious, life-threatening, angio-invasive. The term angio indicating a vessel, which may be a blood vessel or a lymph vessel. Angio-invasive fungi are those that have the capacity to enter blood vessels. Mucormycosis is characterized by its ability to invade blood vessels, that is, angio-invasive. Angio-invasive in the brain, lungs, bones and heart of the patient. Because of this, angio-invasive fungal infections cause significant morbidity and mortality. Now we come to know why we are calling mucormycosis is a serious, life-threatening angio-invasive. Next, we are going to see why is mucormycosis called as black fungus infection. It is so called because it causes tissue necrosis. Any necrosed, decomposed tissue produces a scar, and that is colored black. We must note one important point here, that is, black fungus is not actually black. The fungus does not derive its name from the color of its filaments or hyphae, but due to the blackening it causes on the host body it infects. The tissue becomes dark, that is almost black in color. So we are calling it as a black fungus. We learned why is mucormycosis called as black fungus infection. Next, we are going to see why black fungus is infecting COVID-19 patients. We know that black fungal infections after COVID have been widely reported from multiple countries. Mucormycosis, which has an overall mortality rate of 50%. Severe cases of COVID are treating with high doses of steroids, a life-saving treatment. Steroids reduce inflammation in the lungs for COVID-19 patients, but they also reduce immunity and push up blood sugar levels in both diabetic and non-diabetic COVID-19 patients. Steroids save lives, but they simultaneously make a patient more vulnerable to attack by bacteria or fungi which are already in their body or in their environment. Next, we are going to see, is black fungus contagious? Black fungus is not a contagious disease. It does not spread from one patient to other person. It does not affect normal individuals whose immunity is high. It is considered to be an opportunistic pathogen and usually infect people with an impaired immune system or damaged tissue. Symptoms. Symptoms depend on the part of the body fungus has infected. Some of the black fungal symptoms are one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of mouth that quickly become more severe, fever, cough, chest pain, shortness of breath, excessive redness or swelling around a wound, abdominal pain, vomiting, gastrointestinal bleeding, etc. Treatment. Mucormycosis is a life-threatening condition and invariably prove fatal within a short span of time, particularly when diagnosis is not established or proper antifungal therapy is not instituted. The therapy can be divided in 4 concomitant approaches. First one, rapid correction of underlying predisposing condition of host like diabetic ketoacidosis. Second, surgical debridement of the necrotizing tissue. Third one is antifungal therapy. And fourth one is adjunctive therapy. So it is clear that there is no way to avoid breathing in spores, but one can do a few things to lower chances of mucormycosis, like wearing a face mask, avoiding infected water, avoid activities that involve dust and soil like gardening, etc. I'm concluding this video here and see you soon in my next video. Thank you, friends.